Smoking is the leading preventable cause of death in the United States. Cigarette smoking causes more than 480,000 deaths each year in the U.S. This is about 1 in 5 deaths. It affects almost every organ of the body. It causes many diseases, and the general health of smokers is reduced, as I've seen in hospitals working nursing shifts. Smoking and/or tobacco use causes cancer, heart disease, stroke, lung disease, premature birth, low birth weight, stillbirth, and infant death, as cited from Centers of Disease Control 2010. Now I would like to share with you the diseases that can occur from smoking, how it damages our lungs, and that a longer life is possible if we quit today. Cancer can occur in smokers. Toxic chemicals in cigarette smoke weaken the immune system. A weak immune system makes it easier for abnormal cells to keep growing and reproducing. In this way, exposure to tobacco and/or tobacco smoke can cause cancer and then inhibit the body's effects to fight it off. Cited from American Cancer Society 2014. Types of cancers are cancers of the throat, the mouth, the nasal cavity, the esophagus, the stomach, the kidneys, the bladder, the pancreas, the cervix, and acute myeloid leukemia can occur. Cited from Be Tobacco Free 2014. Also, smoking can cause heart disease. Tobacco smoke uses inflammation leading to narrowing of small blood vessels that supply blood to the organs, including the heart. Smoking can cause chemical changes that make platelets in the blood stick together, forming clots. The chemicals in tobacco smoke also interfere with the body's ability to repair damage in artery linings. Clots are more likely to form in a damaged artery. Smoking causes plaque to build up and clog arteries. Plaque, which is made of cholesterol and scar tissue, can break free and form clots. Clots can block blood flow to the heart, causing chest pain, weakness, and/or a heart attack. Cited from Be Tobacco Free 2014. Furthermore, smoking can lead to a stroke. Clots can block flow to the brain, causing strokes. Clots can also block blood flow to the limbs, causing skin ulcers and eventually tissue death and amputation. Arteries that are completely blocked can cause sudden death, cited from Caratania 2010. Smokers are on the edge of life with every puff. What smoking affects most is our lungs, and lung disease can arise. Smoking causes lung disease, including chronic obstructive pulmonary disease, known as COPD. COPD includes emphysema and chronic bronchitis. People with COPD have damaged airways and slowly die from lack of oxygen. The number of Americans suffering from COPD is increasing, and there is no cure. Genetic factors also make some people more susceptible to lung disease from smoking. Resource from Centers of Disease Control 2010. Of course, other respiratory diseases can occur in smokers. Smokers are at an increased risk of getting pneumonia and other respiratory infections. Cigarette smoke can trigger asthma attacks in asthma sufferers. The lungs' defenses are weakened after years of tobacco smoke exposure. Chronic inflammation from continued exposure to tobacco smoke makes the body become less able to repair damaged lung tissue. The only proven way to reduce the risk of tobacco-related lung disease is to stop smoking completely. Reference from Healthy People 2014. Now, there are immediate and long-term health benefits of quitting for all smokers. When quitting, Beneficial health changes that take place within 20 minutes. Heart rate and blood pressure drop. 12 hours. The carbon monoxide level in blood drops to normal. In 2 to 12 weeks, circulation improves and lung function increases. In 1 to 9 months, coughing and shortness of breath decrease. In 1 year, risk of coronary heart disease is about half of that of a smoker. In 5 years, stroke risk is reduced to that of a non-smoker. In 10 years, risk of lung cancer falls to about half that of a smoker, and risk of cancer of the mouth, throat, esophagus, bladder, cervix, and pancreas are decreased. In 15 years, the risk of coronary heart disease is the same as a non-smoker. Reference from JHA 2014. Quitting is beneficial at all ages and it's possible. Nicotine replacement and nicotine medications can make quitting easier. Quitting gives the body a chance to heal from the damage caused by smoking. Cited from Centers of Disease Control 2010. 1-800-QUIT-NOW is a toll-free telephone service that can help individuals who want to stop smoking or using tobacco. Conclusion: smoking decreases our body's functions and makes us prone to unnecessary diseases. It can decrease our immune system and mutate our cells, leading to cancers. It causes change in our blood's flow, forming clots to cause heart disease and or stroke. Also, it greatly affects our respiratory functions, arising lung diseases or other respiratory changes that take up our oxygen and make it hard to breathe. Quitting is possible and it is necessary to live a longer life. Smoking no longer has to be the leading cause of death. So let's quit now by calling 1-800-QUIT-NOW or by using a nicotine replacement medication. Here's a video to help you quit smoking today.
Hit it!
It takes two to keep you breathing right. If you can't chew it, it will be a fight. It takes two to keep you breathing right. No more asking, hey, you got a light?
I want to smoke right now. We're your lungs in, here's the lowdown. We want to live in a smoke-free zone. We talk to the others, we're not alone. So don't be stupid, be courageous. Get that away from me like it's contagious. Our alveoli like to expand. It's nice when oxygen reaches the hands. We want the heart beating nice and strong. You'll make it hard, and that's just wrong. Emphysema, it ain't no joke. Keep on smoking, you'll have a stroke. So let's stop, cuz
it takes two to keep you breathing right. Get that tobacco out of sight. It takes two to keep you breathing right. Without teeth, it will be hard to bite.
I'm gonna stroke right now. I've got skin that looks old and sags down. I look cute with my teeth all brown. Chemicals giving me butthole mouth. COPD makes it hard to breathe. Thought I was cool, but I'm a dweeb. Now cancer is the hand I've got. A trach and I lost my voice box. So please stop while you can. You don't want to be where I am. I didn't have to chew, I didn't have to smoke, but I did, and I'm a dope. All these toxins I put in myself. Don't buy the cigs off of that shelf. Just say no to the nicotine. Wouldn't you rather your lungs be clean? So stop now, cuz
it takes two to keep you breathing right. Quit tobacco, live a longer life. It takes two to keep you breathing right. There's no doubt that we can win this fight.